What's up? My name is Anna. I am a ICU travel nurse and I am starting CRNA school in about a month. So excited. In undergrad, I worked in an admissions office for about a year and a half. When I was in nursing school, I interviewed the oncoming cohort for the next BSN cohort. I am really passionate about giving people tools to succeed in the interview process, and this is the video, what to expect as a new grad when you are applying to new grad jobs. And there are going to be timestamps down below so that you can scroll along and refer back to places, and then I'm going to have a document on my blog, annaricisrn.com, with 20 of the most commonly asked interview questions for your new grad job. So go check it out over there and subscribe here and we'll get into it. So the first thing we're going to talk about is your presentation before we get into the interview tips itself. Just clothing wise, I would say dress business professional. And as nurses, this is the only time you will ever have to do this. I only wear my suit when I'm interviewing. That's it. But this is a time where you really want the interview panel to be focusing on your personality and your character and what you bring to the table, and not to have anything that is going to detract away from that. I have always heard the advice and followed it to pretend you are interviewing at an Ivy League on the Upper East Coast. Dress, I would say, kind of muted colors, business professional, clean cut. I usually wear either a navy suit or a black suit and maybe a white or a light blue button up. There's all this stuff about psychology, about what the colors you wear portray as interviewees. Something about blue is like trustworthy and calming. Green, I think, is like energetic and full of life and potential. Keep it very muted and professional would be my recommendation. For women, I would also say just make sure that your nails are well kept. Nurses, we also typically don't have manicures if you're working bedside, at least. So I would say just keep it a very basic manicure. And then if you're someone who talks with their hands like me and you're tempted to mess with your hair, I would say just put it back. Or if you are used to wearing your hair down and you don't really mess with it, that's not really an issue. Just make sure that it looks really nice. Same with makeup. I would say something that's like pretty neutral colors, because you're really trying to just have the committee focus on your personality and your character. That's enough about the boring stuff in presentation. Dress suit or pantsuit is fine for women, but suit with a jacket, I would say. Very traditional. Next, we're going to talk about emotional intelligence questions. Often you'll hear that you're going to have clinical questions coming out of nursing school. I think that there's been a shift recently to really focus on emotional intelligence questions. And what do we mean by emotional intelligence? Emotional intelligence questions, to me, are all about is finding out your character and your thought process. So how you would approach problems and how you sort through that to a solution. And also just to getting to know you as a person. You might be surprised that like 80% of your interview as a nurse is not about nursing. It's about you and your character and how you approach things. So I would say it's best to, right now, make a Google Doc, start writing down examples of times that you thought your character was displayed or that you grew a lot as a person. Examples of this would be times that you went above and beyond for a patient, any clinical scenarios that stuck out to you. Also hone in very deeply on your why do you want to be a nurse and why do you want to work specifically on this unit. Sitting down before the interview and really digging deep within yourself to reflect about your why is going to be very helpful for all of these interviews. Emotional intelligence questions typically are going to look at your thought process for how you do conflict resolution and for how you do patient advocacy. And you can really tell a lot about an applicant based off the way that they present their thought process. So I would encourage you to Google emotional intelligence questions, put those in your Google Doc, type out your answers ahead of time so that you just are really familiarizing yourself with that whole process. Oftentimes it's just you and the nurse manager. Sometimes it is a panel interview with like 5 different nurse managers, all who are vying for the same new grad. Sometimes it's the nurse manager and the assistant nurse manager, and sometimes you have an interview with current nurses on the unit, and then you have an interview with the nurse manager. All of these things are different approaches, and I had interviews like all of that when I was a new grad. Quick little kind of interview overview tips for body language and presentation. Do a practice interview with the questions that you're going to find on my blog and record yourself answering those questions so that you can see from a second perspective what you look like answering those questions, and then make tweaks as you need to. What you're trying to communicate is open body language, that you are excited to learn, you're excited to be there, and that you're passionate about the field. That's really the overall message that you are trying to give to the committee or the nurse manager. However it is, you want to come across as genuine, excited, passionate for the right reasons, and a good fit for their unit. You also need to walk a line of, as a new grad, just be very gracious and express gratitude and be really humble because you are new and they're going to pour into you, teaching you everything that you could ever want to know. I'm going to have, again, the document on my blog for you to go find at that and download that and practice it within your Google Docs, but there are a couple different categories of questions. First question, they're going to ask you, why did you want to be a nurse? And then, why do you want to be a nurse on this unit? And then they will ask, tell us about a time that you did not agree with something that was happening at work and what did you do about it? They will ask you if you have patient care experience, about a time that you went above and beyond for that patient and what that means to you. They will ask you if you could change one thing about yourself, what would it be? And this is where it's okay to tell them what they want to hear. Like, you don't need to say, oh, I wish that I could actually like make it to work and, you know, I always call out and I'm so lazy. Like, don't say that, even if it's true. Say something along the lines of, oh, I'm so hard on myself, and I'm working on being more gracious and taking learning opportunities as an opportunity to grow instead of as a self-criticism, something like that. Or say, oh, well, I previously had been a people pleaser and now I am able to channel that into being a really compassionate nurse instead of being so self-critical. They want to hear, especially, they love new grads who are self-critical, so that's a good weakness to have, in my opinion, even though, it's true for me, but yeah, so don't say something that's going to be a massive red flag for your what is your weakness question. Then they're going to ask if you have had patient care experience in the past. They might ask about your clinicals in nursing school and what drew you to this unit specifically. They will ask you how long they think it's fair for you to work there. Always say 3 years at least. Say like, oh, I would love to be here at least 3 years. I don't know what'll happen in about 10 years, but I look forward to learning on the unit and I hope that I can return the favor and teach new grads of my own in like a year and a half. They love to hear that. Even if you're planning on leaving in a year and a half, you don't need to tell them that. They will ask you what you plan to do in the future. They say, what is your 5-year plan? Do not say finishing up CRNA school. You will say, I look forward to being involved in the unit and doing research and quality improvement projects and leadership and precepting, and I live in the area, I have family here, so I'll likely be in XYZ area, wherever you are at. I am just telling you that you need to get a job and you do need to tell them what they want to hear. And I also want to encourage you to not feel bad about that. Because I would have stayed at a staff job if they had like unions and pensions and nurse-patient ratios and all that stuff. So if you're in a place where the working conditions are suboptimal, do not feel bad about yourself if you need to move after you've learned what you're going to learn at somewhere. Anyway, that's kind of an aside. And then as far as the interview conclusion and what they're going to say when you get the offer, you'll probably hear back in about a week and a half or so, and they're going to want you to commit immediately, and they're going to say you have like 48 hours to accept or decline this offer. As a new grad, you're probably interviewing more than one place. It is okay to accept an offer, and then if a better offer comes up, to then kindly write them back and say, thank you so much for this opportunity. I had to go with another offer because it was a better fit, but I really appreciate your time and I would have loved working on your team. Something like that. It is okay to accept an offer and then turn it down for a better offer later. So just get your one job figured out and then go ahead and pick what's best for you. I want to say to new grads really to just take the burden off of your shoulders for feeling that you have to stay at one hospital for 10 years. You are going into it to help patients and you're going to learn everything that you can and you're going to look for a hospital that's really going to support you in the process. Don't feel bad for choosing you and for doing what's best for you. Questions to ask them, because you want to ask them questions and you want to look like you really have researched the field and like you are going to be a good addition to the team. So you need to ask how long orientation is, whether you're going to have a primary preceptor or many different preceptors. Are you going to go straight to night shift after you finish orientation? What is the length of time typically that people are on nights before they can go to days? Ask about what patient populations you're going to be trained on as a new grad, because sometimes a unit will have like ECMO and things like that, but then you won't be trained on it until you've been there for like 2 years. Ask what your orientation is going to cover. And then ask when people typically start orienting others and when other people typically start becoming charge. If they expect you to be charged before you've been there for a year, and if they expect you to orient before you've been there for a year, it's probably not a safe working environment, and I would say to stay away from that. With your length of orientation, if you're working ICU, your orientation needs to be 16 weeks or longer. Anything shorter than that is a disservice to you and to your patients. If you're working IMC or med-surg, you need a 12-week orientation, at least. It's not a reflection on you as a nurse. You just need training and you need somewhere that's going to structure that. Ask about the new grad residency program and what typical projects people have worked on, and ask if there is specific training for your specialty outside of the new grad residency program. So for example, if you're in critical care, there should be education for critical care separate from the new grad residency program. Ask about parking. Conclude with thanking them for their time and asking about leadership involvement opportunities on the unit. It shows that you are grateful to be there and that you are going to be an excited prospective member of their team. That is a broad overview in a nutshell of what to expect. Check out my blog because I'm gonna have the list of interview questions for you to go and practice. And then I cannot emphasize enough the importance of recording yourself doing an interview, and you're gonna do great. Congratulations on finishing nursing school. Welcome to the real world, and unionize your hospitals. And we need nurse-patient ratios nationwide. Love you all. Bye.